And here we go. This is radiology, your CPT 2020 radiology section. We've already completed all of our surgery section, so there's just a few sections left of the CPT. The CPT starts with your indexing, has some pictures, goes into your guideline pages. I write down some common modifiers for these sections just to kind of trigger my mind. So you might see a 52 reduced services. You may see a 76 repeat procedure or repeat radiology, professional components and technical components. Those are probably the most common modifiers that you would see in this section. I will say I want to go all the way in the front, and it's going to be on page 23, but it's actually Roman numeral XXIII, which is 23. These pages will help you in understanding the different body planes and views, body aspects that radiology uses, how they divide the body. This will very much, this page may help you with that. I just wanted to make you aware of that. So here we are in radiology. Remember, we are coding for physicians and not facilities. So a lot of the codes in here will have a 26 modifier, which is that professional component. Unless you're coding for the facility, you wouldn't be using the TC, the technical component. Again, good guidance on your separate procedures. We've already talked about that some. Special reports, we've talked about that with your unlisted or your more unusual type of procedures. Administration of contrast, there's some good guidance here. And then we get right into radiology. So as an overview, before we look at some actual codes, radiology will start with your head and neck, so the top of your body. And if you see, here's your body part, and then you've got radiologic examination. So these are your regular x-rays. Then it goes into MRIs, CTs, or computed tomography. And then you have some more MRIs. And then you have MRAs. So make sure that you're reading the difference between the imaging and the angiography for the magnetic resonance. Okay? And then this pattern flows just like it's consistent throughout radiology under your body parts. It flows kind of like your musculoskeletal. Once we got into the fractures, you had open, closed, percutaneous. You kind of always had those three very consistent up underneath the body parts. So that's the same here. Here's your chest. Same kind of thing. Here's your x-rays, your CTs, your angiography CTs, your MRIs, and your MRAs. Okay? One thing to look at or pay attention to when you're going to pick your x-rays is the views. Are they single view, 3 views, 4 views? Are they unilateral, bilateral? Let me think of some other, just looking here, maybe I got them all. Always make sure that you're picking complete, like code 70130, complete of the mastoids is a minimum of 3 views per side. So if the doc says it's complete, but you only have 2 sides, 2 views, well, it wouldn't be. Okay, your spine and pelvis, same format underneath here. Here's your x-rays, actual x-rays. Then you get into your CTs, your MRIs, MRA, CTA, angiographies, MRIs, again, MRAs, myelographies, epidurographies, discographies, Then we're into upper extremities, lower extremities, and it's the very same. So again, it's the same theme. Find your body part. Then once you get in your body part, sometimes like in cardiovascular, a few times you're going to need to know your action before your body part. But most of the time, if you can identify your body part and then the action, whether it's radiography, musculoskeletal, whatever it is, you at least will get in the ballpark of knowing where you're at. Abdomen, this would include your KUB. KUB stand for kidneys, ureter, and bladder. So we have CTs, CTAs, MRIs, MRAs, then the gastrointestinal, and it just flows like this. Urinary. One thing a note to include with urinary, this does include these urographies, do include the catheter placement, but you would need to code extra for the injection of dye or contrast. So I always make myself a note. Remember, I make myself notes so that I don't leave out codes that I need to code extra for. There's your GYN and obstetrical. Your heart. Now we're into vascular procedures. So we're a little bit different type of studies. They're still radiographical. So this is aortography. So this is taking pictures of the aorta. Could be up high, which is thoracic, or down lower, which is abdominal. CTs, CT angiographies, still of vessels. Here's angiography, start here. And there's a note here for your angiographies, code also, or any of this, code also injection of dye and introduction of the catheter. So one thing to make note of, used to be a pretty popular code that they've deleted now, 75658. It tells you where to go for it. I'm used to the 75658, and so I had to make myself a note. But that's all that is. If you're not used to it, then you probably don't need that note. Here's your veins and lymphatics. So this was arteries. Now we're veins. Same type of thing, taking pictures, lymph pictures, spleen pictures, vein pictures. Your transcatheter procedures that are over here, make sure that you're reading your guidelines here because it's telling you what all is included. So you don't want to unbundle. Under other procedures, remember this is our catch-all throughout the entire CPT. Your 76,76000, you're going to want to report in addition to a radiology code. So, and it tells you some of the codes that you're going to not report this with because it's bundled in. But this fluoroscopy can be bundled onto several different codes. Now we're into diagnostic ultrasound. And again, that area we start with our body parts again. So we start at the top of the body. So here's head and neck ultrasound, chest ultrasound. So you have to know your action, your body part and your action. Abdomen and retroperitoneum. Here is pelvis, but it's going to be obstetrical and non-obstetrical. So if your patient's pregnant, you're going to go here. If they're not pregnant, you're going to go to the other area. Really make sure your pregnancy ultrasounds that you're really reading. You're going to have to know what trimester it is. You're going to have to know if it's transvaginal or transabdominal. I think most of these will be transabdominal because they're pregnant. You have to know, is it for fetal issues? Is it for maternal issues? Is it a first gestation? Are there multiple gestations? Is it to look at the cord? All of that. I have to circle words like in 76811 plus because my eyes just may not see that. I have to underline limited and follow up on 76815 and 76816 because my eyes just may not get that. I'm just being honest. That's the kind of stuff that I underline, circle, star, so that I rapidly see it. Now, for your non-pregnant patients of the pelvis, here are your choices of ultrasounds. Genitalia in general, ultrasounds. Extremities, here's your ultrasounds of extremities. Could be called Dopplers too. For specific spectral and colored Doppler evaluation, you'll go to the medicine section. But your regular ultrasounds, this is where you would find them. Ultrasound procedures. So if they use an ultrasound to put in the central venous access from the cardiovascular section, this is where you would code it. This is it. I label it because it's a fairly common code, depending on what you're coding. Other procedures, your catch-alls. Intraoperative ultrasonic guidance, pretty generic, but it might get used. Now we're into fluoroscopic guidance. These are add-ons, if you see. They're all add-on codes. Code 77002, you're going to code also for your needle placement. Here's your MRI guidance, your CT guidance. So you have to know, is it ultrasound guidance, CT guidance, or MRI guidance? Now we're getting into the mammograms. If the patient has a symptom, it's going to be a diagnostic mammogram. Or if the patient's had breast cancer in the past, a problem in the past. If there's never been a problem and they're just having a screening mammogram, then code it only to the screening. Bone and joint studies. Then we get into radiation oncology. I have several notes in here, and I have to kind of label stuff in here to keep it straight in my head. So radiation oncology is going to be those radiation treatments for malignancies, mostly malignancies. So this first section is going to be a provider section. There is a section in here that only the facilities use. So that's why I have a provider labeled and then I have a facility labeled. So in here, know the difference between a simple, intermediate, and complex. Know these differences in these different sections. So in this clinical treatment planning, what the provider is doing is so they have a patient that has a malignancy and is going to need radiation oncology. Radiation treatments, how we would see it layman's terms. So they have to plan it first, depending on the patient's age, the sex, where the cancer is, what stage the cancer is, how far it is, if it's early stage, that kind of thing. So these three codes are for the planning of the provider, okay? You would never bundle these codes with 77427, and we'll come to that code in just a minute, but I put that in here just to remind me the doctor gets to plan. And then the doctor, once he makes a plan, he has to simulate it. So this is a simulation area. So we have planning, simulation. The simulation is going to be where he plugs it into a computer or some type of program that will simulate what the prediction is for what he's planned. Is it going to be effective? Is it not? Does he need to make it more strong? Does he need to have it weaker? What is that? All of the variables of the specific patient goes into simulation, and then they simulate acting out the plan to see how effective it will be. Whoops. Then you have your calculation stage. Dosimetry is a calculation. Again, these are not bundled with your 77427. These are standalone codes. There's a lot in here. This is the dosing, the calculation of the dose of radiation that they're going to get. So there's teletherapy, brachytherapy, special dosimetry, treatment devices. if they need shields, that kind of thing, depending on where the cancer is and where the radiation is going to treat. They may need to have shields to protect the organs, that kind of thing. So that's in here. So let's go back. For radiation oncology, we have the physician planning, we have him simulating, and we have him calculating the dose for every radiation treatment. Then it will be determined the patient needs this much for this amount of time, this many times a week. So maybe 3 treatments or fractions, they're called fractions in here. A treatment is maybe 3 times a week for 6 weeks. And that's what he will have figured out by the end of these 3 steps. And then is there shielding needed? Are there custom molds that need to be made? That type of thing. So then over here, the radiation treatment delivery, this is the facility only codes. They wouldn't be delivering radiation in the doctor's office. So the hospital owns the radiation equipment or the standalone cancer treatment, whatever it is. The facility owns it. They pay the techs or the nursing staff, whoever is there, to administer it, to monitor the patients, to assess the patients, to check them in, to check them out, that kind of thing. So that this is the technical component. You would not code this in an outpatient physician-based coding scenario. So then we get into the treatment management. So look at the difference. This is treatment delivery, which is technical component only. This is the management side. So we're back to the doctor managing. So he's done his planning, his simulation, his dosing. Now the patient's actually getting the treatment of it, and he has to manage that patient. Maybe they go get a treatment and are deathly ill from it. Or after 2 weeks, it isn't working. It's not being effective. So he has to continually manage that. So, overarching high level, your radiation treatment management is billed on a weekly basis. You would use a 26 modifier on here for a professional component. Make sure that you're reading these guidelines. Here's your 77427. This is your radiation treatment, 5 treatments. This is per week because it's being billed weekly. So knowing that there may or may not be a variation to those 5 treatments, the guideline up here tells you code 77427, this code, is also reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of the course. So the very last week of treatment, they end up doing 3 to 4 more fractions that week. It is not billed separately. It is billed separately. Report 77 is also reported if there are, so you don't bill it, sorry. You do this. See, I'm telling you, I get myself turned around. If it's 3 or 4 fractions more at the end of treatment, you do bill extra. If it's only 1 or 2 fractions at the end, then you do not. It's not reported separately. Sorry about that. If you don't use this stuff, you kind of lose it, and you got to go back and really read word for word. So, at the end of treatment, the last week they have 5 treatments and they need 4 more, 3 more, 5 more. You do not bill separately. You do bill separately for that. At the end of treatment and they get 5 treatments and they have 7, 1 or 2 extra, you do not. 1 or 2 is not extra, 3 or more is. Okay. Make note, look at code 77431. This is radiation management with complete course consisting of 1 or 2 fractions only. So the doctor did his planning, did his simulation, did his calculating, and thinks the patient only needs two treatments of radiation. So this is the code that you would use. The entire treatment course is only going to be 1 or 2 fractions. You do not buddy this onto 77427 for a few extra. And it tells you right here, 77431 is not to be used to fill in the last week of a long course of therapy, because it's very, very common for people to do that. Okay. Clinical brachytherapy. This is good. Some guidance here. Again, know your simple, intermediate, and complex. Hyperthermia. This is heat treatment, radiation treatment. Then we get into regular nuclear medicine. This is nuke med. We've all had it done, and they inject dye. So again, find your body area. This is diagnostic, endocrine system. This is your lymphatics or hemopoietic, your GI system, your cardiovascular, your muscular. Okay, this is nuclear med. So this is maybe myocardial perfusion scan for your heart. Maybe you're having some chest pain, that kind of thing, and they think that's what you need. That's the stuff that's in here. Respiratory system, nervous, genitourinary. Again, we have an other procedures, which is a stinking catch-all. Sorry about that. There's nothing I can do to make that easier. You just have to kind of be used to it. Your spec is in here. And then we have some therapeutic. Remember, all of that was diagnostic. Then we have just a few codes that are therapeutic. And that's the radiology section. So let's do a few examples of stuff in here. Let's do a computed tomography or a CT guidance for needle placement, radiological supervision, and interpretation. So this is a CT guidance for needle placement. So we had that. It isn't going to be with the regular x-ray stuff. We're going to be doing radiologic guidance. Okay. So we have to specifically find CAT scan for needle placement. So here's fluoroscopic for needle placement. So that's not it. So here's computed tomography guidance for needle placement. So our code would be 77012. 77012. Let's do a regular x-ray of the sacrum and the coccyx. So we know that the first of the radiology section starts with just head to toe regular x-rays. So this is radiological examination. That's a regular x-ray. Our body part is sacrum and coccyx to view. So we've got to get to our body part, spine and pelvis. So sacrum and coccyx would be the bottom part of the spine, somewhat in the pelvic region. So, and we're under x-ray. So now we just got to specifically find that code for that body part. And I'm still looking. Let's see. Radiologic x-ray. Sacroiliac joints, no. Radio examination, sacrum and coccyx. There it is, minimum of 2 views. So we plugged everything in. Code 72220. So I found my regular x-rays under my spine and pelvis. Then I had to go through all the MRIs of different stuff and x-rays to get to my body part. You may want to go through here and underline all of the body parts. That might help you. Let's do radiologist provided supervision and interpretation of a retrograde angiography left brachial artery. So let's think through that. Retrograde angiography left brachial artery. So we have to get past the x-rays, remember? So we have to get into the vascular procedures. This is a brachial artery, so we're under artery, so we're getting close. It's specifically an angiography, not an aortography. So here's our angiographies. So let's walk through where we are again. Vascular procedures. This is a retrograde angiographies. Angio meaning vessel. So we're vascular procedures. We know it's the brachial artery, so we're under arteries, not veins. We find our angiography and then we come down from there. So here, 75710, angiography, extremity, unilateral. This is only the left side. And it includes radiological supervision and interpretation. So we would code 75710-LT. Okay, good. Let's do some more. Let's do radiologist performed a complete abdominal ultrasound, real time with image documentation. So again, we're not in the front with x-rays. We're now into ultrasound. So let's get to ultrasound first. So here's our diagnostic ultrasound. Then what's our body part? Our body part is a complete abdominal ultrasound, real time. So here's our head, neck, chest. Here's our abdomen. So we want ultrasound, abdominal, real time. He did document complete. So 76700 is your code. Okay. Let's do patient underwent fetal biophysical profile with non-stress testing due to a suspicion that fetus was in distress. So this is a biophysical feedback. So again, this is going to be ultrasound. There's a baby, so it's obstetrical. Specifically for biophysical feedback or profile. So we have to find the code that includes the fetal biophysical. So I'm just going to I just have to start reading. So this is ultrasound first trimester. There's not a problem. I'm going to have to find, so this is nuchal, this is fetal and maternal with detailed exam of the fetus. This is ultrasound pregnant limited, ultrasound pregnant real-time follow-up for suspected or confirmed. So here we go. Fetal biophysical profile with non-stress testing. 76818. And that's how I have to read and kind of find it. Plug in the information that I've pulled out of the scenario and then try to plug it in. That's why for me, the underlining, that kind of stuff helps me get through the codes faster to find what I need. So here, if we had not had the non-stress testing, it would have been 76819. Okay, let's do one more in here. Let's do one that includes multiple codes. So fluoroscopic guidance for needle placement during a liver biopsy. So let's think about that a minute. So the patient is laying on the table, they're having a biopsy done of their liver, and the doctor is using fluoroscopic guidance for that. So what's the big dog? What would be the procedure that you would do first with that? The fluoroscopic guidance is helping to do the big dog. So it's actually that liver biopsy that would be first. So let's get to digestive. Remember, at the back of digestive is our accessory organs. And I'm not sure in there yet. We have to get all the way past all those colonoscopies and stuff that we've already been through. Whoops, past the hemorrhoids. So here's our liver. So I've got to find a liver biopsy code first. That's the big dog. That's the reason they've shown up. The fluoroscopic guidance is just helping to do it. So liver biopsy, needle, percutaneous. So let me read my scenario again. Fluoroscopic guidance for needle placement during liver biopsy. So needle, percutaneous, it's going to be through the skin. So this is going to be our first code, 47000. And like a lot of codes in here, underneath that code is going to probably be a parentheses that helps guide you to what, if you need a radiology code, what that might be. And we do have that under here. So if imaging guidance was performed, we know it was fluoroscopic. So we've got 4 codes to choose from. So you may be brand new to coding, so you just start going to those codes. So I happen to know that it's going to be 77002 because that's my fluoroscopic. You'll figure that out really fast too. So here's my fluoroscopic guidance. Here's my add-on code for 77002, fluoroscopic guidance for needle placement. And I have a note that tells me I have to code for the needle placement too. So how I would sequence this would be the 47,000 and then the 77002. We already know because the 77002 is an add-on code, it can't go first anyway. It's a piggyback. So that liver biopsy ended up being the big dog procedure, and then the fluoroscopic guidance just piggybacked on it. Okay, let's do a little bit more. And again, I had a question or a question after one of the videos. The textbook that I've been using throughout all of these, and you guys should be too if you're kind of doing your own self-study to get your CPC, is the 321 Coded book. This is a fantastic book. It has great examples. A lot of the scenarios that I'm reading, well, not a lot. Some of them are straight out of here. Helping you to see how to use your CPT book. I strongly recommend getting that textbook and the workbook. It's just extra practice for you. So I think the textbook is excellent. Okay, let's do some radiation oncology codes. So let's get here first so that we're not scrambling. A special teletherapy port plan for the total body. So special teletherapy port. So remember, we had all the different devices and custom molds being made under the calculation or the dosimetry treatment devices section. So here's your teletherapy. But we want, this is isodose. We want teletherapy specific to special teletherapy port plan. So here we go. 77321 special teletherapy port plan, total body. So we were able to plug in all of our words. Sometimes you can't plug everything in and it just doesn't feel good. But when you can plug in all your words, it just it feels like you finally might know what you're doing. Okay, let's do another one. Therapeutic radiology simulation aided field setting of a single treatment area with a single port was performed. So here, let's go back and think through this. They gave us the word simulation, so that immediately makes you go to simulation. So therapeutic radiology simulation, single treatment area, single port. So if we look in here, therapeutic radiology simulation, we have simple, intermediate, and complex. So let's go up here and look what simple means. This is what I'm saying you need to know. You have these resources. We have documentation of a single area. So simple is a single treatment area. So code 77280 would be the code that you used. Okay, let's do a few more out of nuclear med, so we kind of know how to use nuke med. Here's our nuclear med. Oops, such a glare, I'm sorry about that. Nuclear med, therapeutic radiopharmaceutical is injected directly into a vein. So we're nuke med, now we have to find our body part. So I don't see vein. So I'm going to keep going. So it's therapeutic. So we are in nuke med. Therapeutic radiopharmaceutical is injected directly into a vein. So here's my radiopharmaceutical therapy. Oral, IV, intracavitary. So that means straight into the cavity. It's pretty interstitial. So you see the different intra-articular, that would be straight into a joint. So IV, intravenous, is 79101. See, it's not so hard once you kind of break it down to where you got to go. Let's do one more. Patient underwent cardiac shunt detection. So we're still in nuke med. Let's go back to the beginning of nuke med. Sometimes I have to go back to the beginning and then do my body parts again. So this is nuke med. Patient underwent cardiac shunt detection procedure. So let's get to the heart. Let's find our body part. Cardiovascular. Patient had a shunt detection procedure. Shunt detection procedure. So I gotta read. That's what you guys should be following along and reading too. Cardiac shunt detection, 78428. Plugged it right in. So I found nuke med, I found my body part, and then I found my code, 78428. So that, on a basic overview of how to use the codes in your radiology section, we will do Path and Lab next, and I'll see you in the next video.